Good morning. My name is Crompton Maxwell. Can you say your name for the record, please? Good morning, my name is George Wilson. And what is your candidate number, please? My candidate number is 250125198. Thank you. And you are taking this test as a nurse. Is that correct? Correct. Thank you. Can I see your ID, please? Sure. The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. Give an example of a time you had to interact with a hostile patient. How did you handle the situation and what was the outcome? Unfortunately, hostile patients often are part of the job. It's important to remember some of the patients are being hostile because they are in pain, away from family, and in the hospital setting. There was a time a patient refused to take her medication. I tried everything but she would spit them out at me when she tried to take them. Because of this behavior, I involved my charge nurse, the physician in charge of her care, and the social worker. After many conversations and phone calls, it was determined the patient was spitting the medication out because she liked it mixed in chocolate pudding. The woman was elderly and suffered from dementia. It was only after speaking with a social worker did we learn of her medication preference. She was not able to communicate with us her wants and needs, and this led to hostility. Tell me about a time you were under a lot of pressure. What was going on, and how did you get through it? I was the most senior nurse in the unit by over a decade. I had to not only handle my patient assignment, but I also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others. Tell me about a time when you didn't know the answer to something at work. How did you go about finding the information? As nurses, there is no way that we possibly can know everything. Knowing who to go for help is the first step. At the beginning of every shift, I identify a nurse that I can use as a resource, such as a charge nurse, nurse educator, or unit resource nurse. This individual is generally someone that is more senior with an advanced skill set. If I am unable to get the answer from them or they are busy, I look at the healthcare system's policy and procedure manager. If there is a concern regarding a medication dosage or interaction, I look to LexiComp. Talk about a time when you had not communicated well. How did you correct the situation? This often happens when there is a language barrier. I learned that it is always better to ask for an in-person interpreter or utilizing a computer translation software. This ensures there is no miscommunication of information. Unfortunately, hand gestures and speaking louder doesn't always work. Describe a time when you went over and above your job requirements. What motivated you to put forth the extra effort? I personally feel like I give 110% to all of my patients every shift, but there was one that I grew especially close with. For some reason, the patient had been dropped off by a family member, and no one had come to see the child for months. It was obvious the patient was missing key developmental milestones, and was becoming increasingly lonely and depressed. I asked to become the primary nurse for the patient, which meant, every time I worked he would be assigned to me. I worked with him over several months to get him potty trained, and to improve his vocabulary. I don't know exactly why I was extra motivated, but at that time in our lives, the patient and I needed each other. Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? No. You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes. Thank you. You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please? Good morning. Myself, Jane Brinton. I'm the head nurse in charge today. For confirmation, may I know your name, please? Hi, good morning, nurse. I am George Wilson. Hi, Mr. Wilson. How are you feeling now? Well, not much. To be frank, I'm in pain. Okay, if you don't mind, can you please rate your pain in pain scale of 0 to 10? Where 0 is no pain, and 10 is the worst pain? I can truly say that it is 10. I'm sorry to hear that. You need to take good care and need maximum rest possible. I understand, nurse. I know that I have to take a rest and need much care. But what I can do for this pain? It is nagging me and making me mad. Well, did you get good sleep yesterday? No, I felt the same pain. The pain didn't allow me to sleep well. I do not understand why this pain again. Isn't my operation a successful, nurse? Actually, it was. However, we have to find out the reason why you feel the pain again? Yes, sure. Can you please explain to me about the pain and where exactly the pain is? I'm feeling pain all around the hip. I feel the pain the same as before the surgery. Oh. I am sorry to hear that. All right. May I know how you are going to find out the reason for my pain? What are the possibilities of pain after surgery? As per the doctor's advice, we are going to take an X-ray and MRI scan for better understanding. The possibility of pain after surgery is not very common. There are chances of some minor complications which are needed to be resolved sooner. Complication. What do you mean? How are you people going to treat me again? If it is a case of complication, you may require another minor surgical management to relieve the pain completely. My God, another surgery. I underwent an operation just a week ago and now you are telling me about another operation. It's quite terrible. Do I really have to undergo an operation again? I acknowledge your worries. But I didn't mean that surgery is mandatory for your pain relief. It is just a possibility. The surgery is only recommended if the pain persists even after taking medication. All right, but now I'm not physically and mentally ready for another surgery even if it is required. I really don't want to face that fear. I realize your concerns. Hope you will not have surgery again and will get well sooner. In fact, in these cases, a second operation is very rare. All right, still I would like to know the reason for my continuous pain. Your questions are really appreciable. Many patients have complained about the pain after surgery that will go off after a week or so. But in your case, the pain is still persisting. Yeah, that's right, I am really worried about my recovery. Do I get well or not? Of course you will. You do not have to be worried. Everything will be all right. Yes, I too hope for the same. I really don't like to be hospitalized again and again for the same reason. The hospital stay is making me weaker. I can sense that it is hard for you, but you need to be strong in this situation. Every doctor in our hospital is providing expert care to their patient and they performed well in your case too. Okay, so what am I supposed to do now? Should I wait for a second surgery or follow the medications? Yes, that was the right question. For now, you need to follow all the medications as per the doctor's order. Presently your consultant has prescribed you with some additional painkillers which can elevate your pain to a greater extent. They will really work and will surely eliminate the need of undergoing a second operation. Are you sure? Yes, tablets will definitely help you to feel better and make you well. Yeah, I am also expecting the same. Okay, Mr. Wilson, for now, you need not worry much. You just follow all the medications and take proper rest. We are here to help you. Great, anyway I will try my best not to think about it and relax. Good, you need to take enough rest without getting disturbed from the thoughts of pain, as those thoughts may disturb your mind and alter your sleep. All right, I will do my utmost. Great. Thank you for listening to my words. I hope I have cleared all your doubts. Yeah, you relieved my stress a lot. Thank you. And kindly press the call button on your right-hand side if you need any kind of assistance. Sure. Take care. I wish you a very speedy recovery. Well, thank you, nurse. With pleasure.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.